everyone. My name is Jada Wilkerson. Along with my group members, there's Kiana and Michaela, and we are Group 4. We will be presenting our strategic plan on reducing racial disparities and maternal mortality among African American women by improving prenatal care access and healthcare equity. First and foremost, maternal mortality remains one of the most significant public health challenges in the United States. Although many pregnancy-related deaths are preventable, African American women continue to experience much higher rates of maternal death than other racial groups. Today, we will discuss why this issue exists, the factors contributing to it, and the strategies our program proposes to improve maternal health outcomes and promote healthcare equity. Okay, so let's go ahead and move into the problem. Maternal mortality refers to pregnancy-related deaths that occur during pregnancy or within 1 year after giving birth. This is a serious public health concern because many of these deaths can be prevented through early intervention and access to quality health care. Pregnancy places significant demands on several body systems. The reproductive system, of course, supports pregnancy, childbirth, and postpartum recovery, while the cardiovascular system works much harder to meet the increased needs of both the mother and the developing baby. The placenta also plays a critical role by providing oxygen and nutrients to the fetus. Because pregnancy affects so many body systems, regular prenatal care is essential for monitoring both the mother's and the baby's health and identifying complications before they become life-threatening. Unfortunately, African American women are disproportionately affected by maternal mortality, making this an urgent issue that requires targeted public health interventions. Now moving on to the background and significance. When we look at the data, the disparities become even more concerning. Black women are approximately 3 times more likely to die from pregnancy-related causes than women of any other racial groups, despite many of these deaths being preventable. Additionally, the United States has a higher maternal mortality rate than many other developed countries. Several factors contribute to these disparities: delayed access to prenatal care, structural racism within healthcare systems, implicit bias among healthcare providers, chronic health conditions like congestive heart failure, and limited access to healthcare services all increase the risk of poor maternal outcomes. This is why action is necessary. By improving access, equitable, high-quality prenatal care, we can reduce preventable maternal deaths, improve health outcome for both mothers and babies, and move closer toward achieving maternal health equity. So why did we choose this intervention? There are several medical conditions that commonly contribute to maternal mortality. These include severe hemorrhage, hypertensive disorders, infections, cardiomyopathy, and blood clots. Some warning signs and symptoms that require immediate medical attention include severe headaches, vision changes, heavy bleeding, high blood pressure, and of course, chest pain. Recognizing these symptoms early can be life-saving. Healthcare providers diagnose these conditions through routine prenatal screenings, blood pressure monitoring, blood tests, ultrasounds, and urinalysis. Current treatments depend on the underlying condition, but may include blood transfusions, antibiotics, blood pressure medications, magnesium sulfate, and mental health support when needed. These medical interventions are most effective when women receive consistent prenatal care early in pregnancy, reinforcing why improving access to care is such an important part of our strategic plan.
Hi everyone, my name is Kiana, and for this part of our presentation, Hi everyone, my name is Kiana, and for this part of our presentation, I'll be discussing the goals and objectives of our program. To reach our first objective, we plan to introduce a community maternal health navigating program. These navigators will work one-on-one with pregnant women by helping them schedule appointments, arranging transportation if needed, enrolling in health insurance, and connect with them on the importance of community resources like housing assisting and nutritional programs, and also mental health services. The program will also be hosting monthly community workshops in partnership with the local churches, health centers, and community organizations. The workshops will educate women about the importance of early prenatal care, healthy pregnancy habits, warning signs during pregnancy, and resources that are available for their support, both during their pregnancy and after. They will also allow women to schedule prenatal appointments on site. Um, our second objective focuses on improving the quality of care that the women are receiving. Healthcare providers participating in the program will complete annual training on implicit bias and cultural competence. This training will help providers recognize unconscious bias and communication more effective with the patients in providing respectful maternity care. Finally, we will participate in patient feedback surveys after prenatal visits to learn about the women's experience, like the communication, their trust, the respect, and the overall quality of care. Program leaders will review the feedback every month or every few months to identify areas for improvement and ensure the program continues to provide equitable care for African American women. Together, all these strategies will aim to improve maternal health outcomes and help reduce preventable, and they will help reduce preventable maternal deaths. Um, our
Our program focuses on preventing maternal health complications by improving access to prenatal care and addressing the barriers that often delay and prevent African American women from receiving this health care. One of the main components of our intervention is the Community Maternal Health Navigator program. These navigators will work one-on-one with participants and provide access to scheduling appointments, transportation, enroll in insurance, enroll in programs like Medicaid and WIC, involve community involvement with the churches, organizations, household assistance, mental health services. We will also provide monthly prenatal education workshops in partnerships with local churches, community organizations, and healthcare providers. They will cover everything that you need to know: early warning signs, what to expect, how to handle all of that as you're navigating through this time in your life. Finally, participating healthcare providers will complete annual implicit bias and cultural competency training, combined with strong community partnerships as well. These strategies altogether will help create a more supportive, patient-centered healthcare experience with reducing the barriers to care. With our end user involvement and evaluation, this is one of the most important parts of our strategic plan. Because of this, you get to hear the women that are participating in this. It can provide valuable insight into what is working well and what still needs improvement. After each prenatal visit, participants will complete patient feedback surveys that focus on communication, trust, respect, and the overall quality of care they received on their visit. Instead of collectively feedback just once, our program leadership will review these surveys quarterly, and so we can work on progress, what to improve, how to make it better, and fill in the gaps that are still in the program. We will also continue working closely with healthcare providers and community organizations to make sure the services remain responsive to the needs of the community. By actively listening to all the moving parts in this, we improve patient satisfaction, strengthen the trust between patient and provider, ensure the program continues, and it's evolved based on real lifetime experiences. Our expected outcomes are divided into short-term, intermediate, and long-term. In the short term, we expect more women to begin prenatal care earlier, increase their knowledge in what they're expecting, become more aware of the resources available to them. We also expect healthcare providers to become more confident in delivering culturally responsive, patient-centered care. The intermediate outcomes include increased participation in prenatal care, greater enrollment in programs like WIC and Medicaid, improved patient satisfaction, and stronger communication and trust between patients and providers. We also hope to identify pregnancy complications earlier through consistent prenatal care. In the long term, our goal is to reduce racial disparities in maternal mortality among African American women by improving maternal and infant health outcomes. We also hope to increase equitable access to high-quality prenatal care, strengthen the partnerships between healthcare systems, community organizations, and build trust between all of these moving parts. In conclusion, maternal mortality among African American women remains a significant public health issue, but it is one that can be addressed through evidence-based, community-centered solutions. Our strategic plan focuses on improving access to prenatal care while also addressing the systematic barriers that contribute to these disparities. Through patient navigation, provider education, community partnerships, and continuous quality improvement, we believe this program can improve maternal and infant health outcomes and advance healthcare equity. In conclusion, maternal